The first step is when a patient is admitted to hospital, they are screened. We've kind of applied a unique lens to it. So we look at the disease state, but we've also applied evidence and review on malnutrition. If the individual is assessed by the screening at risk, the dietitian then would go and do a comprehensive nutrition assessment or a subjective global assessment.
I'm the shipper-receiver here, and our job is to place everything as it comes in.
Okay. Hi, Dante. We're going to film a little bit in here. Is that okay? What is incredibly important is that we are always turning over product. So whatever comes in really should be going out to the production area. So in this room, we take all of the food products out of the boxes and we put them on these specially made shelving units. And they allow us to properly thaw the product at a safe temperature in a safe amount of time. Once it's reached its proper state and it's coming up on the menu, it goes into this area. And this is where we have specialized staff called inventory controllers working to decant the food that will be for the next day's tray line.
So seeking new technologies is really part of what I do, and it's really looking at that big picture. How can we make this better? So what is the problem and how can we solve it? And very frequently, technology can help solve certain problems.
So here we have inventory controllers that work to portion hot cereal, which they're doing right now. This is oatmeal.
Every department utilizes some type of automation, whether that's a tray line that's going to move the trays for them, whether that is a machine that automatically will portion out hot cereals or soups and will lid it for staff so they don't have to push down and have that wear and tear on their body, or whether it is our belts that pushes food along in the sandwich area. So those are all examples of automation that really improve efficiencies and reduce repetitive strain injuries on staff.
We have two tray lines that are running simultaneously. They're spinning in opposite directions. So when the staff are working, they work half of their shift on one line, which we call A line, and then they switch and they work the other half of the shift on B line. The trays are moving in opposite directions, which means one tray utilizes the right side of the body, one tray line utilizes the left side of the body more, again, to reduce that repetitive strain. We have the main, which is a chicken parmesan today, and garlic toast, but we also have all of the availability items that are available for people's preferences if they don't like something, as well as all the different texture modifications that we have, and foods that correlate to different allergies. And in fact, almost every tray ticket will look different.
With the Indigenous population, we do like to make sure we have offerings available to them. So we work very closely with our suppliers and distributors to see if we can get access to culturally appropriate meats. We source locally produced bannock for those individuals. We also have items such as kosher. We are trying to work to provide more halal meals. If people have culturally appropriate foods, they feel safe, and that will also encourage their intake, which promotes healing.
The second last position here we call the checker. So they are verifying the accuracy of the tray. Their job is to ensure that what is on that tray is exactly what is on the tray ticket. Now we're seeing our clean dock here. So this is where our clean goods are going out to the receiving sites. So nothing comes to this dock, everything is going out. We want to avoid railroads, we want to avoid any construction, and we will monitor that and we will change the routes based on the road conditions. So once we deliver the carts to the sites, they get loaded into these units. So they're plugged in and they're turned on.
We have an opportunity for that feedback all the way through their stay, where we have tray ticket messages go on the back of their tray ticket that they have a phone line they can call in and provide more information. They can request access to a dietitian, a diet clerk, or a tech in various settings to provide additional preferences if something changes during their stay. And then in long-term care, we have customer service advocates for food service and diet clerks that will go up and visit, as well as dietitians.
So once the meals have been consumed at the site, they get loaded back onto the same carts that they were originally placed on, and they get loaded into the trucks where they are taken off to be cleaned and sanitized. So this is a constant influx of dirty carts. The warewashers never end. So they never get to finish like tray line does. So they've completed their tray line, they're done, they can wrap cutlery or clean. There's always an influx of dirty wares. Once the items are taken off of the trays, they're loaded into our 3 industrial washing machines, which all wash specific items.
Never closed the doors and we've never skipped a meal of service since we opened.
We're always dreaming and seeking new opportunities to find new entrees or items that become available to patients and residents that would be based on their feedback that we get from resident council or just individuals. We would attend different food shows to kind of see what's new and innovative and products that we can try, and then we would bring those products here and consider all factors, all the clinical standards, all the food service operation capabilities, the cost of those items, and we would try many different ways to produce that and plate it to be the most appealing and effective for both clinical nutrition and for the food service, as well as having a nice end result for the patient and resident. Food is essential for life, and without adequate intake, it makes it very difficult to heal and recover from any type of medical condition that one might have.
Do it this way for the grandma.